Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, a podcast endorsed and sponsored by kidneysolutions.org.
Hello, everybody. This is Kent Bressler, and we're coming from the banks of the Guadalupe River in Kerrville, Texas, where it is exactly 101 degrees week after week after week after week. We continue to trudge through these heavy temperatures. You know what's interesting about it, too, is it never changes. It's 90 at night. So anyway, the point here is that we get to talk to patients and people that work really close with kidney patients. And today we're going to do that. But first, we're going to pray. So, to our dear Lord and Holy Spirit, drive away from us all forms of sickness and disease, and restore strength to our bodies and joy to our spirit, so that in renewed health we may bless and serve you now and forevermore. And we ask this in your name, O Lord. Amen. I really don't know how to introduce this person that's going to be on today, other than to say Erin Kahle is probably one of the closest friends. They say you have 5. You can name all your friends. You can put them on one hand. Well, I think she's my little pinky. That's how close I am to this gal. She's just an excellent tactician. She works for the American Association of Kidney Patients, dear to my heart, AAKP. And she's a deputy director. So at least we got a deputy in the house. So that's what we're going to talk to her today. And I'm going to tell you, when you're done listening to this, I want you to share it, because it's not only a discussion with her, but it's a discussion about an organization that is steeped in tradition and does everything for kidney patients. So you can't say that the AAKP isn't in it for the patient, because they are. They're patient-focused and patient-driven, much like we are at Kidney Solutions. That being said, hello to you, Erin Kahle from AAKP. How are you?
Hi, Kent. I'm great. How are you? Thank you for having me on your show.
Yeah, well, not only is it exciting, but it allows me to just talk to you, because we've had many talks at presentations and at patient enclaves, and we started way back when with National Kidney Foundation. You were there, and I'll tell you, folks, what this gal has done. She actually launched me on the path to advocacy in Washington, D.C., and has given me opportunities that I don't know how you ever thank anybody about this, because it is so important to me to be an advocate for kidney disease. And she's been the one that really actually did get me started, and I appreciate her very, very much. So what in the world is a deputy director?
Well, it's a great question. Well, I think maybe starting out, I should share how I got into the kidney space and how I got to this spot, if that's helpful at all. So back in 2003, I was a few years outside of college, and went to college in Greensboro, North Carolina, and decided to make the big move to New York City, where my sister was living. So I knew somebody there. But I moved, and I was looking for a nonprofit job. I had worked in nonprofits since graduating, and did a lot of volunteer work through high school and college, and just absolutely loved it, and thought I wanted to make a career out of it. And went on a lot of interviews, and one interview was with the National Kidney Foundation, and it was just a home run interview. Everything went well, and I heard later that day that they were offering me the job, and I accepted it right away. And I had the pleasure of starting out working with kidney transplant recipients and recipients of other life-saving organs. And I think that was probably the best foray into working with kidney patients, because you see all the positives and all the amazing things that can be accomplished by kidney patients when they're given the opportunity and the ability to be part of society and to give back and to do things. So I started as a transaction coordinator, which sounds kind of transaction-y, but really wasn't. It was the name of a council or committee that we had at the National Kidney Foundation, which meant Transplant Plus Action. So really showcasing that transplant allowed people with kidney disease to return to full-time work, have families, have social lives, be part of society, and give back. And it became a passion of mine very quickly. Back in those days, NKF was the organizer of the transplant games. So I was very fortunate to work on 4 different transplant games, and I worked a little bit on the transplant side, but mostly on the donor side. So I organized the Living Donor Recognition event, which was a happy and fun celebration, recognizing those important living donors. And then I also worked on the donor family recognition ceremony, which is a much more somber, sensitive event, but equally important, recognizing those amazing individuals that passed away and were able to donate their organs to save the life of somebody else. So I did that at NKF for many years, and then from there expanded into the advocacy and policy world, where I met individuals like you and brought people to Washington, D.C. to talk to lawmakers about important issues like immunosuppressive drug coverage, Living Donor Protection Act, and really bringing a face to what kidney disease is. So through that program, I met not only transplant recipients, but also individuals on dialysis, people with early stages of kidney disease. And so that kind of set up where I am today, in that I work with patients all across the spectrum. We do a lot on early diagnosis and awareness of kidney disease, what the associated conditions are, risk factors. We do a lot of work with dialysis patients, and of course, transplant recipients, care partners, living donors. So I would say, as deputy director of this amazing organization that I've been a part of since 2017, I have the pleasure of working with all of our stakeholders, everybody involved in the care of kidney patients, most importantly, the kidney patient themselves, family members, care partners, those that live with them, love them, take care of them. And then also federal agencies like Medicare, Center for Disease Control, Food and Drug Administration, Department of Defense, you name it. And then we have our industry partners, such as pharmaceutical and device companies. So as deputy director, I really have my hands kind of in every little piece of what goes on in the kidney space, and making sure that kidney patient voices are heard and are part of the discussion when those conversations are happening, where government agency or a pharmaceutical company is deciding what is best for a patient. Well, we know that the patient needs to be part of that discussion. And so we're really adamant about identifying those patients that would be a great voice to include. And that's one of the things that I love most, just being able to identify people and pull them into a situation that maybe they wouldn't normally have that opportunity to do, like talk to FDA or CMS or things like that. So
Yeah.
do a little bit of everything.
You
as
do a
deputy
lot.
director.
You do a lot as deputy director, and AAKP is very fortunate to have you employed. Tell me a little bit about the ambassador program. This is a major love of yours, and I know you've developed it at AAKP. You're pretty much the sole developer of this program. I wanted to just have you explain that to the folks out there that are going to be listening to this.
Yeah. So I was actually brought on to AAKP, and one of my main charges was to develop an ambassador initiative, which is really a group of high-level, motivated, engaged individuals across the spectrum of kidney disease. So patients themselves, family members, care partners, and living donors who want to be part of those conversations that I mentioned. They want to be part of the change. They want to do what they can to improve the care of kidney patients, change the status quo. We all know that dialysis isn't the best treatment. It hasn't, advanced much over the last couple of decades. So these individuals want to be part of whatever discussion can be had to make those changes, to improve treatment, improve care, make sure that patients and physicians are having conversations and discussions, that they're working together to find out what is best for an individual. It's not one size fits all care for everybody. So our ambassadors are really key to getting the AAKP message across. So we have a really robust presence on social media. We have a great membership where kidney patients, family members, donors can be members for free, no charge. But we know there's a lot of individuals out there that we aren't reaching on a day-to-day basis. And our ambassadors really help to educate those individuals, find them, bring them to AAKP so that we can offer them these different opportunities, like sharing their voice, being part of a focus group, or answering a survey. So we have over 170 ambassadors across the US. And we've even, in the last couple of years, expanded globally. So we have about a dozen ambassadors across the globe as well. And that number just continues to grow as our global initiatives have been expanding over the last several years. But these individuals are amazing. You're one of them. But
happy to be one of
them. I'm always learning so much from our ambassadors. I like to think that with almost 20 years spending time in the kidney community, I know a little bit about what patients go through. I would never say that I know exactly what they feel, but I feel like I have a good sense, and I can identify people who can speak on it. I wouldn't say I wouldn't speak on their behalf, but I know who I can put into a certain situation to talk about living on dialysis or getting a preemptive transplant, or the struggles with immunosuppressive drugs, that sort of thing. So having ambassadors is kind of like a big networking opportunity. So
it sure is.
Yeah. So we use them a lot to reach those people that we don't normally reach. Ambassadors are very active in their local communities. So they may be doing like health fairs, or what they call dialysis lobby days, where they have a table in their dialysis center's lobby and they can share information and resources. And then a lot of our ambassadors are also active on social media. Like you have a podcast. There are several ambassadors that do a lot with podcasts and videos. And so it's always helpful to have those ambassadors not only share our messaging out, but share with us what they're hearing from other patients that maybe aren't coming directly to us.
Anybody can be an ambassador. Is that a fair statement?
As long as they're a kidney patient or a family member of a kidney patient or a living kidney donor.
Okay. So those
Yes.
are the three criteria. And
Those
how
are
in
the
the
three
world do you
criteria.
become one? What do you have
It
to do?
is
Give you a call, or
very
how does that work?
easy. Yeah, you can give me a call. You can email me. We have a short application. We just want to know a little bit about your background, where you live, if you are, what kind of a patient you are, what modality of treatment you're on, if you know your cause of kidney disease. We kind of want to know some of that background
Sure.
information. If you are working, what you do, if you volunteer time with other organizations, what are those organizations, just to give us an idea of how much time, we think that you're able to commit or to dedicate to our efforts. So there's the short application, and then we have a little kind of a committee of people that will review those applications. And then we'll reach out and we'll get you signed up as an ambassador and put you to work.
You can also go through the website, aakp.org, aakp.org, and you can sign up there. All right.
Yep.
Yeah. And that's probably the easiest way. And they have the application right there. Because when we're busy doing what we're supposed to be doing and we're trying to work real heavy with patients, it's hard to just pick up the phone, and it's always a callback. It creates a lot of help for the organization if you just go through the website. And so if you're listening, aakp.org is the place you want to go. So in your experience, how difficult is it? Actually, how difficult is it? Or is it even difficult for you to really get people involved? Is it pretty easy, or is it a struggle to get people to come in?
That's an interesting question. I don't know that I can give you a direct response to that. Sometimes it's easy. Sometimes there's individuals like yourself that come to us and you're already engaged and you want to do whatever you can. And then there's other individuals that maybe hear about us and they like the work that we're doing, or they know another ambassador or a board member and they say, oh, I want to be involved in that. And they reach out to us, but they have so many other commitments, family, job, other activities, spiritual life that they have. So for some people, it's harder. They make that initial outreach and they're excited about it, but it's hard to find that time to really dedicate. So I would say it's kind of a mix. And there will always be people that aren't 100% committed and dedicated and available at every time. Every time we have an opportunity. But we just appreciate having people that are interested, and we'll work with them on what their schedule is. If they have an interest just in policy versus just in education, we'll work with them to find the activities that are most appropriate or that speak the most to them.
That's pretty much it.
Yeah,
it's up to them.
Yeah, I think so.
It's really up to the individual to get started, and then you can dedicate it. If you're the one out there that wants to do this kind of thing, if you want to quote pay back, if you're a transplant patient, or if you're a donor and you'd like to really get in a circle where there are a lot of donors, this is where to do it. I mean, the AAKP is an interesting organization because it's all focused on patients. It's not off here doing something else, and it's a global, personality, if you will. Lots of people from foreign countries. I know of several that have joined to be members at AAKP. England and Ireland and New Zealand, and just say a few. And it's a very important project for anyone if they get involved, and you can spend as much time as you want. And the more you spend, the more you want to give back. A couple of us have the old saying, you know what? Pretty hard to say no to Erin Kahle and AAKP when they call, because they're not reaching out just for the fun of it, just to keep you active. They don't have a drive like that. The drive is, we know that you can do this. We are asking you to do this. It's not for AAKP, it's for the patients.
Mm-hmm.
And I think that's very important. People think, oh, I got to do this for so-and-so and so-and-so's organization. No, you don't. You're doing it for patients.
Mm-hmm.
And if you lose sight of that, then we got problems. So we try to focus real heavy with patients in mind and their families, but in general, what is it we can do to make their lives better?
Right. And you touched on something, it's for the patient. So, hopefully what you're doing as an ambassador is improving your life and impacting you on a positive level. But I think the ultimate hope is that you're impacting others.
Exactly.
Whether it's through simply raising awareness and educating about risk factors or treatment options, or who to go to if you have questions or need help, all the way through impacting policy and impacting the development of new medicines and therapies, to either slow the progression of kidney disease or to help with dialysis complications or transplant anti-rejection drugs. So you're not just helping yourself, but you're helping the larger kidney community. And the most important thing, I think, is making sure that your perspective, which might not be the same as another kidney patient's perspective, but that it's heard, that it's understood, and that that perspective is incorporated into all of these different things that people, policymakers and researchers, are working on to hopefully improve the care for kidney patients.
I think most of the time when people look at kidney patients, they know very little. And if you haven't experienced it, it's very difficult to explain. And you sit here and you look at a whole room full of people, and a third of them probably have kidney disease, and they all look the same. All right. It's not, oh, I look so horrible disease. It's it's a pretty easy disease to look at, but it's very hard on you internally. People who have it know that what's going on in their bodies is not a good thing. All right. And it doesn't come where you can see it until the very end. And then we try to work real hard at AAKP is to address this whole process early. There's always been an urge to get people to dialysis, and that's not where we're at now. There's an urge to get them transplanted before they go on dialysis. And I think that's what we advocate at Kidney Solutions. And I know it's what AAKP advocates for.
Yeah. And even an urge for finding a cure or finding something that helps slow the progression of kidney disease where you would need dialysis or a transplant. And, that's always hard to think about. There is no cure for kidney disease, but there has to be something in the works that helps or puts off the time that you need to start dialysis so that you can maintain a job, a family, all your aspirations.
You can live. Sometimes that I think it's most important. You mentioned earlier, all of this stuff revolves around you, the individual, because you have to be given options. You can't be told what to do. You can't be enabled, because this disease is very progressive. Everybody says, oh, you can slow it down, you can do, but I can tell you what, the vast majority of people with kidney disease are very surprised at how fast it can move. And so preparation and urgency is probably the most important thing that you have to have in your life when you're looking for a donor, or if you're trying to get a transplant, or you're facing dialysis. And I feel that's something that AAKP does. There is an urgency among the administrative group, the executive group. They want to get it done now. They're not waiting. Waiting is not in their vocabulary. So, that you're part of that organization that I think has not only made inroads, but continues to improve the lives of kidney patients. And that's honorable in my book.
Yeah. I think our organization is pretty unique in the fact that our leadership, our executive committee of our board are very involved in the legislative process, have served under different presidential administrations and as legislative aides for Congress, and works with the Department of Labor and Homeland Security. So they have the background and the knowledge on what it takes to make change happen in Washington, D.C. So I think we're unique in the fact that our leadership, we're led by a patient majority board, and those individuals have that experience and knowledge to really push us forward in ways that maybe other groups can't, because they don't have that background of public service. So I'm really fortunate to work for such an organization, and
I see the smile on your face, and I know
Yeah.
I know where you're coming from, because I know who you're talking about. You're talking about Paul Conway. And
Yep.
Paul Conway, we'll give him a shout out here. He's really the backbone of AAKP. And it's not lost on me the work that he puts in and the background that he has. But still, if you talk to Paul, you get him in the corner, you sit down and talk with him, it's all about you. He wants to know about you. Okay, he wants to know about, how things going, and how can we help you, be successful at what you're doing.
Right.
And that, I think, is the whole frame when you talk about Richard and, Ed and Jennifer. Everybody looks out for it. It's like a big old family, like it is
Yeah.
at Kidney Solutions. It really is. And everything is run tip top. Diane runs a tight ship. She's got everything in order. And it's nice to come into something that's progressive, understanding, but mostly has love for the people they're working with. And that you get at AAKP.
Yeah.
So.
Yeah, we don't have secrets, and we don't have an agenda that we don't make sure others know about. We're very transparent as far as what we do, and what we do is making sure that patients are included, and just doing whatever we can to improve the care of patients, and hopefully improve on access options, treatment options, making sure patients have access to those FDA approved drugs and treatments that that are out there, and maybe there's hurdles with insurance companies or other payers where they have to go through step therapies or other hurdles to get access to a new drug that would really benefit them. So everything that we do is really to provide access to all those options. Might not be the right option for you, but we want that to be available.
Everybody's different. And you know that as well as I do. We talked about that in the past a lot. What's good for you is not necessarily good for the next person, or what's good for them is not good for you. Mm-hmm. But at least you know that whatever it was that worked for them, if it doesn't work for you, there's something else. And I call it the grinding factor. We just keep grinding on, right? We stay in our lane. When I say we're talking about kidney patients. Try to stay in your own lane and make sure that you're getting all the information you can get. And AAKP provides that. Just simply going to aakp.org, you open that up, It's amazing the stuff you get. You want a gourmet meal? There's a place to go. You want to learn about exercise? There's a place to go. You want to talk to somebody? You really want to talk to somebody? You want to get in a focus group or a support group? They'll get you there.
Yeah.
So whatever it is that they can't get you there, they'll develop it so you can't. And I think that's significant. And that's what AAKP does.
Yeah. If you want to learn about a rare disease, if you want to learn about how to get involved in a clinical trial, what that means, and how to advocate for yourself, how to talk to reporters, how to talk to Congress. Yeah, we provide all of that kind of training. We have webinars, we have recorded sessions from past events and meetings up on our YouTube channel. So, and if we don't have something up there, let us know, and we'll work on making it available.
Yeah, you can also, if you have a technique or a presentation, you throw it in and they'll take a look at that. And if it's suitable for, publishing or showing up on YouTube, it's going to happen. I don't think there's anything mysterious about this organization. I mean, it's transparent, it's focused, and it understands the kidney patient comes first, right? Do they actually get all the information they need? How many of them are sitting on panels that, in pharmaceutical panels or in dialysis panels or transplant organization? Are their patients involved in the dialogue? If they're not, AAKP is going to step up and say something. They're not beholden to them just because they're donors. If there is not patient representatives in the concert of the groups, they're going to get an address from any one of who's ever in charge. Somebody's going to call and tell them, look, you need some patient advisory in this. You need some people that are walking the walk, that are doing it. Okay. Right. So
we do get a lot of phone calls and emails from researchers and pharma companies that last minute, we need to have the patient perspective in our proposal or the grant that we're sending out. Well, you do, but you should have reached out earlier to get us involved.
Yeah, we get that. As an example, I was going to tell everybody today anyway. I'll just do it here. We just did a grant. Kidney Solutions did a grant in our small little community here, and received a grant from an organization that's nationwide. It's a huge conglomerate that does a lot of jewelry. All right. It's started small and built up in Kerrville, Texas, and became a major player in the jewelry market, silver jewelry. I will mention this, James Avery. And we got a $20,000 grant from them yesterday. So these things work out because nobody in this board knew that we existed in this little podunk town of Kerrville, Texas, until they saw our grant. And when they started looking at it, they actually gave us more than we asked for.
Wow.
So then the importance of the importance of saying what's going on with you, in other words, telling your story, helps everybody. You tell your story, it helps everybody who's a little bit hesitant to do that. But I can tell you one thing for sure. Once you start telling your story and it gets out there, it makes waves. Doesn't make little ripples, it makes waves.
Yeah.
So, tell your story.
Yeah, and it never hurts to ask, whether it's for funding or if it's just, can I share my story with you?
Right.
Over the phone or email, or can I, take 5 minutes of your time and just talk to you about what I'm trying to do? We encourage that. We want to see people feel empowered, that they can not only come to us, but be comfortable talking about their journey with kidney disease and what they want to see changed and how they think they can incorporate themselves into that process.
We have a large, I think, underserved population in this part of the country. And there are a lot of Hispanics that live here in town. We've been, friends and neighbors for a lifetime. And the vast majority of the workforce at this particular place, this particular plant, has a lot of kidney disease. And so we've offered, as Kidney Solutions, a couple of us have offered to come in there and give presentations and talk about kidney disease. And then if anybody's, looking to find a donor for we're going to step up and help and do that.
Mhm.
All right. And as you know, we don't charge anything. We're a free entity, and nobody has a salary. So all the money that we get turns back into the patient.
Mhm.
And that is an important part of AAKP because they're connected with a lot of groups like us.
Mhm.
All right. That is a penchant for AAKP. Work with the little guy because they'll be big someday.
Mhm.
And they're making inroads, and that's what's good about kidney disease. Nobody knows about it. It's always lumped in with something like diabetes or lumped in with, heart disease, and
Right.
it has very little independence. And the research dollars show that. So,
Mhm.
and now that there's AAKP is really aggressive in their search for research dollars for kidney disease. And that has to happen if we want to get a cure for this.
Mhm.
And that's the ultimate goal.
Yeah, absolutely. And in the meantime, as we're working towards a cure or treatments, it's just making sure that the individuals now that are living with kidney disease have the best options and treatments available, and that they're educated. And we always joke that the kidney community is so small because it seems like there's such a tight knit group of people working on kidney disease, but it's really an enormous community. There are
Oh, it's
so many
huge.
people impacted by kidney disease.
Huge.
I can't tell you how many times I've gone to a conference or something in another state, and my cab driver asks, "Oh, why are you here?" And I tell them, "I'm here for a conference on kidney disease." And then the cab driver says, "Oh my gosh, my mom is on dialysis," or my
My brother
uncle
just had a
a
transplant.
transplant. Yeah, it happens
Yeah.
so
All,
often.
yeah.
Hmm.
When you throw it
But you
out
never
there,
know.
yeah,
You never
you
know who
don't.
you're talking to. And, like you said, kidney disease is kind of one of those invisible diseases
Killers.
where you can't look at somebody and say, "Oh, they have kidney disease."
No.
So you really never know who out there has some kind of connection. Um, so really education and awareness, and I think sharing your individual story, once you're comfortable with that, then all the doors open
Oh yeah.
uh,
Yeah.
open for you.
There's an old saying we have at Kidney Solutions. If you can't tell your story, if you don't tell them your story, first of all, they can't pray for you. And second of all, they cannot give you what you need.
Hmm.
So you even if you have to start with somebody who can sit with you and instruct you on how to do it, practice it with them, just the initial engagement, the first time you actually tell your story and ask, I can tell you that it'll change your life.
Yeah.
And it has changed your life. I know you've talked
Mhm.
about it all the time. You gotta speak up. You gotta be your
Mhm.
own best advocate.
Yeah,
So,
absolutely.
well, I hate this. I just literally don't like the word hate, but I do. I'm discouraged by the fact that we got to kind of tone it down here and get back to work.
Okay.
Tell me, in closing, what would you recommend to somebody who what do you recommend for patients with kidney disease? What's on the highest priority for you for them to do
Mm,
to make their lives better?
yeah. Number one, I think is connecting with somebody that has kidney disease. Not to scare you about, what you might face in the future, but to prepare you. If you're newly diagnosed, maybe the individual that you connect with had a long diagnosis and a long time before they started dialysis, so they can tell you what they did, maybe as far as going to the doctor regularly, taking care of themselves, eating right, that sort of thing. So I think really,
We call that
it-
mentoring where we come from.
yeah.
Yeah,
there
there's the
you
word
go.
you were
That's the
looking
word
for. I know
it.
you use it. So that's
Yep.
exactly, it's mentoring. It's
Yeah.
different than advocacy. It's mentoring is being
Right.
there for somebody. All right.
Yeah, making that connection with somebody and learning firsthand. We always say, you can learn a lot from somebody that has a science background or a medical background, but you can learn more from a person that's living with that
Absolutely.
condition.
Absolutely.
Because that scientist will never know, your daily struggles or how many pills you take a day. They won't understand or really know how that impacts you and your family, and everything that you do. It kind of circles around this schedule of when to take your meds or when you go to dialysis and when you go to get checked up at the doctor. So really the best thing I think is talking to somebody who's been through it and can provide you real life experience of what to expect, maybe tips on what not to do, questions
or what
that
you can get away
ask.
with.
Yeah, there you go. Yeah. Oh, sorry for the dog bark.
Yeah, it's all right. We like dogs. It's a podcast. So
yeah.
One of the things that really excited me about getting going in AAKP was I got to come into Washington. I got to sit with people that knew what it was like, that had done a lot of work in it. But the most important thing was that I was part of that.
Mm-hmm.
I was part of it. And it made me proud. And somebody said, well, you got to go to Washington. No, I didn't get to go to Washington. I got to go with AAKP.
Yeah.
Washington was just the place. If they'd have been in Oregon, I'd have been there.
Mm-hmm.
So I just want people to understand that joining an organization, free organization, no dues, no fees, no anything except knowledge. And if you join the group, you join AAKP, I guarantee you'll be happy. And if you're not, we'll make you happy. That's all I can say about it.
Yeah, we won't ask anything of you. We won't ask anything of you, but we'll just ask that when you're ready, you come to us, you answer a survey or be part of a focus group or something to let us know your perspective, but we'll never coerce you or
nope.
Kind of urge you or push you into doing something. So come to us. We have a lot of education resources, and if you see something that's of interest to you, jump on it and let us know that you want to be involved.
Or learn from it and grow in it and learn how to do it and then be a mentor to somebody else. Mentoring is a big word at Kidney Solutions because that's what we do. We do it. We're not donor hunters. We're mentors. We follow you through the whole process. Before, when you start looking, educate you, get you in a small group or getting in a support group. Then we're there when you get transplanted, the day you're transplanted, either virtually or in person. But the biggest thing is we follow you afterwards to help you keep your kidney. And that, trust me, that is the biggest thing in transplant. It's not the surgery. It's not finding a donor. It's being able to take care of yourself and keep that kidney.
Right. What comes next? It's not just getting a transplant and everything's fine and dandy.
It's
you have
not.
to take care of it. You have to still advocate for yourself and learn about all the possible side effects and returning to work and everything. There's still a lot to learn once you get a transplant.
And once it happens, there's always going to be bumps, no matter what. No matter if you've been transplanted for 6 weeks or 6 years or 60 years, it's going to be a thing of the past. Someday there will be a cure, but right now it's the best we got. Absolute best we got. All right, Erin Kahle. Did you like it?
Thank you so much. Yes, thank you so much, Kent, for inviting me.
Yeah.
To be on.
You know who's next on my list, don't you? Diane. Diana, yeah. Yep. I'm gonna get her in here. So you'll have to share it with her when you're done.
I will.
All right.
I will. Thank you.
All right, we're gonna sign off now, folks. I want to tell you something. This is a good podcast, and if you listen to it and you subscribe to it and you share it, it helps others. Gives you a good feeling that what you've done too is worthwhile. All of these informational podcasts that we do them for one reason, and that's for you. Not for us, it's for you, to get you some excellent experience and knowledge, but to show you that there's hope out here. This kidney disease is, I'll be honest with you, it sucks. All right. And some of us have lived with it our whole lives and prospered. Some of us have had very big difficulties. In other words, can't even get in another transplant. Or we have to go on dialysis for the rest of our lives. It's not lost on us how difficult that is. But you have people like Kidney Solutions and AAKP. These organizations have your best in mind. And I can tell you, it works really well if you'll reach out. Once you've reached out, you're all the way home. And this is where you want to be. You want to be at home here with us. Okay, so next time, we're going to do another podcast. I don't know who's coming in, but we're going to do another one, I think, for sure. And until then, keep breathing.